Erectile dysfunction is very common in men with diabetes. As a matter of fact, if you look at the literature, between 50 and 80% of men with diabetes will develop erectile dysfunction. And so this is really important nowadays because of the kind of the epidemic with obesity and development of type 2 diabetes that we're seeing in this country. There's some good reasons for it. If you look at diabetes, it really you get hit from two things. One is diabetes affects the nerves, the peripheral nerves. So men with diabetes will talk a lot about how they have decreased sensation in their feet and things like that. Same thing with the autonomic nerves that can cause problems with the nerves that help the blood vessels work to get an erection. So they get hit on the neuropathy side, and then on top of that, they also get vascular problems. Just like we tell men with diabetes, you're at increased risk to have a heart attack because you can have problems with the blood vessels. Same thing with the small blood vessels in the penis. So really, they have two significant problems: the problems with damaging the nerves that help with erections, and then also problems with the blood vessels. So erectile dysfunction, common problem. Also, many times the oral medications that we've discussed don't work well in men with diabetes. So many of the men I see with diabetes eventually progress on to needing either injection therapy, and some of them will even need surgery with an implant because the things just don't work well enough. From a preventive side, erectile dysfunction can precede diabetes by several years. And as a matter of fact, one of the things that I'll look at if men come in, let's say if you don't have diabetes and you come in with erectile dysfunction, I'll do a screen, and sometimes we will pick up what's called pre-diabetes, where your fasting blood sugar is high. You're not diabetic yet, but you're on the way to becoming diabetic. And it's a great chance for intervention. So it's another example of erectile difficulty being a barometer of overall health problems. In this case, it could be a warning sign for development of diabetes if you don't correct course and do different things.